Hello, I'm Dr. Shashank Shetty, consultant nephrologist and transplant physician at Aster CMI Hospital. So today I'll be talking about hypertension and kidney. So hypertension affects more than 30% of the Indian population. That is, 1 in 4 adults can have hypertension. And patients with hypertension is one of the most common patients we see in OPD practice. What we are more concerned is young adults with hypertension, that is anywhere between the age of 20 to 40 years of age, who come to us into our daily OPD with hypertension. Usually they are referred to us by their primary care physician, and they come with symptoms like swelling in the legs or a newly detected hypertension, especially an accelerated hypertension, that is very high blood pressure. So how do we evaluate, or how do we go about these patients? So in these patients, we routinely test for something called as kidney function test, where we look at the urea, creatinine, electrolytes. We further investigate with the urine routine and an ultrasound. Sometimes these patients can have blood in urine or a protein leak in the urine. So when somebody has blood or protein leak in the urine, we assume that these cause of hypertension could be related to a kidney cause, and then we investigate further. So we look at, first of all, we quantify how much of protein leak might be there in the urine, and if required, we investigate these patients further in terms of something called as a biopsy, where we take a tissue from the kidney, we send it for testing to know what disease it is. So one of the most common disease what we see in young adults with hypertension is something called as IgA nephropathy. So how do we manage, or how do we treat these patients further? What we do is most important is diet and lifestyle modification in these patients. We ask them to stop smoking if there is a smoker, reduce salt in the diet, and what if somebody is a meat eater or a non-veg eater, non-vegetarian, so we ask them to cut down meat in their diet. So, and somebody is obese, we ask them to lose weight. So these are some dietary modifications we can ask our patients, which will help in managing our patients a long way. Another thing what we do is we control their blood pressure with some drugs, blood pressure lowering drugs. We call this as AC inhibitors or ARBs. These are drugs which reduces blood pressure in the body as well as the kidney. This helps in reducing the protein loss in the urine. Some patients might have aggressive kidney disease. In these patients, we might require to treat them further with drugs to reduce the body's immunity. We call them steroids. Management of patients, young adults, especially with hypertension, is very common in our OPD practice, and we are very good and experts in handling these patients. And we have well equipped with biopsies as well as further kidney related investigations in our department at Aster CMI Hospital.